everybody, my name is Marina Nassif and I'm a senior in high school, a part of the Chancellors Student Advisory Council.
Hi everyone, my name is Tanya Ansari and I'm a senior in high school, as well as an executive board member of the Chancellors Student Advisory Council.
In the Chancellors Student Advisory Council, students and learners across New York City have the chance to collaborate with Department of Education stakeholders to provide student input and to create and inform education policy with the purpose of advancing equity in our system.
The Chancellors Student Advisory Council, the Mayor's Office of Community Mental Health, the Office of School Health, School Mental Health Program are in partnership to create the It's Time, Ending the Stigma on Mental Health short film. Through the production, we strive to share information and prioritize mental health in our school system and shed light on some important factors pertaining to mental health.
To me, mental health means a holistic approach to well-being.
To me, mental health means taking care of myself. It means setting healthy boundaries and taking breaks.
So for starters, mental health to me is a combination of physical, spiritual, and emotional well-being that is in a constant state of flux, so it needs to be maintained and upkept.
To me, mental health is everything. It's our support system. It, relates to how we function in our everyday lives and how we treat ourselves, how we treat each other. It has to do with everything with how we live, and I think it's very important to take care of it so we can take good care of ourselves and take good care of other people.
To me, mental health means knowing how you are and how you feel and knowing why you feel that way.
A lot of the times, again, with a lot of cultures, they contribute to the stigma so immensely that it can create a way bigger impact than it necessarily would if it was just a few people, which again makes the conversation for mental health so, I wouldn't say rare, but it doesn't happen frequently, and a lot of times people are scared to have that discussion because it's everybody deals with that, so why are we even talking about it? Well, because everybody deals with that, that's exactly why it should be talked about.
Culture dictates what is normal and what isn't. In my Chinese community, I've seen how male members in my community have felt emasculated when they talk about their feelings because it is against the cultural norm. This is extremely hard for those who are at risk and need support because it's not only hard for them to receive support in their community, but it is extremely hard for them to be diagnosed from a professional when the illness itself is considered to be fake.
I do feel comfortable sharing my mental health with my friends mainly because when I do, they tend to be comforting, so it kind of draws me back to them and they help me find solutions for it. I feel like that's the main reason why I talk to people about my mental health, so they can help me find solutions, because oftentimes it just happens so that you try to keep it all to yourself, but you have a harder time trying to find a solution on your own. So that's when I tend to then go to other people, and I try to avoid making mental health a taboo topic, because it's something that we should definitely talk about, because obviously everybody has a mental health, and you don't know if when you're having a discussion with your friend, you don't know if whatever is being said in that conversation, it can help them as well and it can inspire them as well.
If they want to say something, I will listen first, and then I will provide professional hotlines and then for them to reach out.
First, just say that I'm there to listen and not necessarily offer feedback. If it's not wanted, which is totally fine. And I like what Angie said about how if you can't answer or just provide that feedback, you would give professional references.
I think just always checking in on people that are struggling with mental health issues is a good way to show them that there's people in the world that care about them and that there's always someone to talk to.
We take part in the Mindfulness Monday initiative, where students are encouraged to do something positive for their mental health. These little check-ins are super helpful in reminding students that it is okay to prioritize your emotional well-being. Also, my school takes part in social emotional learning, where teachers across subject areas will ask us how we are feeling, promoting positive conversations concerning our mental health. Talking about our mental health is so important, and together we can remove stigma around the topic, one conversation at a time.
I would say yes, very much so. We have tons of councils and meetings that support people on their mental health and well-being, as well as teachers also providing, a somewhat good and safe environment to just, feel comfortable in telling them whether we're stressed, depressed, or if anything, if we just need a break. From my experience, my teachers are so understanding.
I wish that the departments in my school, the staff, the mentors, and the teachers would be more public, and they would broaden their reach and their efforts about their availabilities, so that when asking for help or seeking help, it doesn't seem like a task or a chore, something to be embarrassed about, or something to build up the courage for.
When it comes to just mental health, I think it really encompasses one's thoughts and their feelings and how that affects their whole system of their body, and just that cognitive piece and the feelings piece, that marriage, I think, really addresses one's mental health and how it affects their day-to-day, how it interrupts their day-to-day, or how they're able to kind of sustain themselves. So I think mental health kind of encompasses all those particular elements.
Mental health means having the ability to make better choices in life, because you've gained the insight into why you do what you do. And through the work with a counselor or clinician, or from attending a presentation or workshop, you've gained the skills and knowledge to cope better with the emotional and psychological stressors of daily life.
I think some of the major signs that somebody might be noticing a shift in their mental health functioning are related to how they're thinking, how they're feeling, and how they're behaving. So if they're starting to have excessive worry or feeling excessively sad, a shift in their mood, maybe experiencing major highs and then major lows, difficulty with sleep, either sleeping too much or having disturbed sleep and sleeping too little, withdrawing from things that they used to enjoy, whether it's friends or schoolwork, or just a complete shift in how they're functioning overall in school.
I also think we have to talk about racial equity and whether it is embedded in the services that are being provided. I think especially given this past year when we use digital platforms, we have to ask ourselves, what barriers are there in students accessing these services? Not all students are able to find a private space where they can talk to their therapist. And these are things that we really have to think about and consider.
Both physical and mental health are a basic part of safety, and without feeling safe and whole as human beings, then we can't progress to the other levels of us being our best selves and being able to excel. So for me, that's always been a critical part of my teaching, caring about the student as a whole, not just them as a number, as a grade.
If you or someone you know is experiencing any recent changes in their lives that they're struggling with, maybe it is a change in mood, behavior, appetite, or sleep, just know that there are ways to get help. Mental health is important, just like physical health is important. Many students can use some support, and you are not alone.